The following program contains mature subject matter not suitable for young viewers and graphic images that may be disturbing. Viewer discretion is advised. Our next question comes from Kelly via Twitter. Kelly says, when I'm in my Pilates class, I will experience vaginal flatulence. It happens. It's so embarrassing and uncontrollable. What can I do to get this to stop? Would you like this one, Dr. Dow, or you know what? I think I'm going to hand this one off to Dr. Nita. I mean, Dr. Nita, in the bedroom is one thing, and that all couples experience this, but that's one-on-one. Look at it as a light moment, share a laugh, and move on.
Yes.
But in Pilates class, it's a little different.
Well, let's talk about what vaginal flatulence is, right? Basically, you have some air in the vagina and the air wants to get out. Sometimes it comes out, it's silent, just a little secret between you and your vagina. Sometimes your vagina decides to make some noise. That noise may be like a whistle, or sometimes it honestly sounds like your vagina is playing the drums or something. I mean, it can make different sounds. But if it's happening frequently or if it disrupts your life, then of course you can bring it up to your doctor. If it's just happening every now and then you know, you can say, okay, it's no big deal. This is common. This can happen to anybody with a vagina. It's really no big deal, right?
Yep.
So that's the thing about it. But even though it can happen to anybody, we know that people with a weakened pelvic floor have an increased probability of having vaginal flatulence. So you can do some Kegel exercises. But here's the thing about Kegel exercises. Most people do not do them correctly, right? A lot of times people will clench their abdominal muscles or their thigh muscles or the buttock muscles, and those aren't the muscles you're supposed to be clenching. If you're having a hard time deciding where should I be squeezing right now, I would encourage you to stop your urine midstream next time you're in the bathroom. Those are the muscles you're supposed to be using. But that's just how you figure out which muscles are the right muscles. I don't want you doing that on an ongoing basis, because if you're always stopping your urinary stream, then you're not emptying your bladder, and that can increase the risk of bladder infection. So that's just how you figure out how to do it. And you can also ask your gynecologist, because during a pelvic exam, we can let you know if you're doing them right. But this is a quick tip. You can do Kegel exercises anywhere, right? Well, if you do them in the bedroom during intercourse, that can be pleasurable for your partner.
Bonus.
So you can get your Kegels and your partner can get some pleasure. That's what I call A+ multitasking. I'm just saying.
Nita, I love your tips.
I'm just saying. It's good advice. You don't have to take the advice, but I'm telling you, that's some good advice.